I think there's a large education piece. So educate, educate, educate. And I think it's the key to improving diversity, equity, and inclusion work.
Welcome to the Smart Talk series, the show for professionals who want strategies, tips, and real talk about all things PR, marketing, and social media. Your host is Melissa Vella-Williamson, an award-winning, accredited, and nationally recognized PR pro and communication thought leader. And now your host, Melissa Vella-Williamson.
Hello and welcome to the Smart Talk series. I'm Melissa Vella-Williamson. This season, our focus is on communication trailblazers. Today, I'm joined by Thomas Bennett. Thomas Bennett is Senior Vice President of Health Equity PR at the global agency FleishmanHillard. In his role, he's responsible for helping lead the agency's health equity practice, advising clients on their DEI initiatives, and working internally with each global office on their DEI efforts. Thomas has over 20 years of experience, and most of his career has worked in the healthcare industry. He's an alumnus of Fisk University and HBCU in Nashville, Tennessee, and is also very active and an engaged member of the Public Relations Society of America. Welcome, Thomas.
Thanks so much, Melissa. So excited to be here and chatting with you today on the podcast.
Well, thanks for joining me. I've respected your work and your point of view for a long time. Tell us a little bit more about your background and your work today.
Yeah, absolutely. So over the course of my career, I've volunteered and worked for many companies and organizations over the years. And the thoughts and opinions that I'll share today are my own and do not reflect any particular company or organization that, I've worked for or been affiliated with. Definitely a proud alumni of Fisk University, which is a HBCU in Nashville, Tennessee. I'm originally from Little Rock, Arkansas, so you might hear some of my Southern, twang come out as we talk today. But I started my career over 20 years ago in PR, then direct sales, worked in various different marketing roles, then got into diversity and inclusion, then business development. From an industry, perspective, I began my career working for an NFL team and then a MBA team. Over the past 14 years, though, I've mostly worked for companies in the healthcare industry spanning kind of multiple sectors. I've worked for 3 large hospitals and health systems here in the Dallas, Texas area, led business development for a company that offered electronic health record solutions for FQHCs and community health centers and clinics across the country, and also worked at the headquarters of the American Heart Association. I'm currently at FleishmanHillard. My role kind of revolves around many of the things that I'm very passionate about, and also revolves around my skill set and experience. So I work with all of our GMs across the Americas, EMEA, and Asia Pacific on their local DEI plans. Also help lead and support all of FleishmanHillard's health equity efforts on a day-to-day basis, also advise clients on their diversity and inclusion initiatives, and then do a little bit of new business development as well. Internally at FleishmanHillard, I'm also very engaged in 2 of our employee resource groups, the Black Community ERG and our Disability ERG. I'm very passionate about mentorship, and it's something that's important to me. So by way of paying it forward, I mentor a few of our junior professionals within the agency as well. Lastly, the CEO of FleishmanHillard, who is John Saunders, he shares his vision for our agency to become the most diverse and inclusive global agency. And during my recruiting to FleishmanHillard, I heard him express this during a speaking engagement and immediately thought that's something that I want to be a part of. And it meant a lot to me when I heard him express that. And a lot of the work that we do internally, I hear of FleishmanHillard is hyper-focused on that. So that's a little bit about my background and experience and what I'm currently doing here at FleishmanHillard.
Well, that's pretty broad. You're starting with NFL, right? And NBA, and then all these spaces you've been in, then really getting deep into the health space in public relations. That's fantastic. I've discussed on the podcast before, specialties. And I'm really interested in your work in healthcare. Why, Thomas, is public relations important in healthcare?
So PR or public relations is a very broad term and often means different things to different people and companies and organizations. The Public Relations Society of America defines PR as a strategic communication process that mutually is beneficial relationships between organizations and their publics. So when you sit back and think about this definition in itself and the COVID-19 outbreak and pandemic, it really sets in the gravity and critical role that we as PR and communications professionals have in communicating information accurately to our communities and the general public. And kind of given this, PR healthcare professionals have a huge role these days and being the kind of go-to company advisor. And we've seen this, since the onset of COVID-19 until this very day. There are so many rules and regulations and different areas within healthcare that generally evolve. And it can be difficult at times to kind of keep track of all the changes in the industry and marketplace. And oftentimes, PR professionals also play a role in enhancing their respective company or organization's business growth and building its brand. And I think just reemphasize again, since the onset of COVID-19, I think even further enhanced how critical our role as PR practitioners has played in getting accurate information disseminated to our community and our general public so they're well informed and can kind of make the best decisions for themselves, their company, and their surrounding community.
Yeah, I think those like you in the healthcare space who work in public relations and were those true advisors during this time really shone so brightly for the profession. I felt like we grew in terms of PR practitioners grew in our equity during that time, or how much value we had to the community because we could see the difference between someone who's just throwing something together, put it on a flyer, and it's quick, but it's not necessarily accurate, or it's not necessarily sensitive and in some ways fair. And that was so
hit on
important.
that key word, fair and accurate.
Yeah. And, those are pretty fundamental to well-being in society, but they're not always remembered.
Yeah.
And so I think that's really, really important about what you do. And I love that you're focusing now even further or deeper on health equity. What really inspired your commitment to promoting health equity?
Yeah. So health equity has a lot of meaning to me through many personal and lived experiences. I almost get chills thinking about it, but health equity is a very big and broad term, but for me, it means that everyone has a fair shot at being their most healthy and well self, regardless of their zip code, socioeconomic status, education, race, gender, culture, or ethnicity. There are people who can access whatever resources they need, and others who struggle to get the basics that they need, like healthcare. There are certain groups of people who are more at risk for diseases, but have less ability to get treatment. So they may be more likely to become sick or die from preventable diseases, unfortunately. There are so many gaps in health trends that are caused by a lack of access to various resources and are really rooted in unfairness. A person's education, income, employment status, and housing all have an impact on their overall health. These are what we call social determinants of health. When these non-medical factors like these contribute to a difference in health, we call it difference of health disparities. There's data that shows that specifically Black mothers are almost 3 times more likely to die in childbirth than white mothers are less likely to have access to quality prenatal care. And there's no reason for this. This is a classic example of how racial inequity or the unfair and unequal distribution of resources along racial lines. Some people just simply need more support or a different kind of support than others do. Let's take another example. A website that lets you sign up for vaccination is a great idea, right? However, for people who don't have internet access via a laptop or by their mobile phones or a car to get to the clinic, it's still a one size does not fit all solution. I know that's a very long kind of response, but that's why I'm passionate about health equity, to give everyone a chance to live their most healthiest possible life. And that's why I'm so passionate about the work that I do on a day-to-day basis, and also translating that into my kind of outside the workplace in terms of like my interactions with friends and families and those within the community that I live in as well.
You hit on so many true and very good points, Thomas. I truly believe our lived experiences as people, particularly if we came from diverse or adverse backgrounds, really can enlighten our work and impassion us, right? And I think it's important, like you said, through your own lived experiences, you can see the gaps. And then from your professional experience, you can actually start helping to fill the gaps.
Yes.
And that's what I think the best parts of our work is, the most soul satisfying parts is when we can help move that needle in the right way. And like you said, sometimes we just need a tailored approach or more support than other groups. And then you will see, gosh, there's a crossover effect. When we made that accommodation, it actually helped everybody. And I think that's really important about what you do, is highlighting those turning points. And what is that? If we can serve those that sometimes are the hardest to serve, a lot of times you end up better able to serve all. And that's so exciting.
Exactly.
You've done so much in your profession. And of course, so much has even just changed in the profession since you started. So what's really changed about your work in this space in your over 2 decades of experience?
I think what has changed the most about diversity and inclusion, I'll even add justice in there, and also health equity over the past 2 decades or so, is that it has become more of a national, or even I dare say a global conversation. The murders of George Floyd, Breonna Taylor, Ahmaud Arbery, and so many others put social injustices and racism at the forefront of so many people's lives, not only here in the US, but globally as well. Secondly, when you look at the COVID-19 pandemic, it's spotlighting the health inequities that already existed here in the United States. We are not likely going to reach, health equity during a pandemic, but we must do all we can to, kind of keep disparities from widening and to address the root causes of existing health equities. These inequities and social injustices not only shape conversations in our communities, but it also has become, part of our, day-to-day workplace conversations and how we work and how we operate. And then even more so, how agencies like mine advise and provide good counsel to the clients that we serve. And so I think that those are the kind of few things that have changed in the space over the past few decades that I've been involved in this work.
Do you find yourself doing more advising around some of these topics that maybe earlier on weren't as in the forefront of conversation?
Yes, absolutely. And I think that it's a really good positive sign that in my day-to-day work, clients are doing a lot more reach out to us to provide them with more counsel and guidance on how to respond to internal communications aspects of things, or even how they communicate externally to their stakeholders, regardless if it's consumers, patients, or other external stakeholders. And I think that's a really positive sign because at least they're asking the question and wanting guidance and counsel as opposed to not asking for it. But we have seen a higher trend of more of our clients reaching out for overall counsel.
I love that, actually addressing that problem and the challenge. And I'll just say for our listeners that while that is uncomfortable space, uncomfortable work, it's so important. And so it is a positive sign, even though it's an uncomfortable space to be in, it's the right move forward. So I love that you're seeing more of that, Thomas. Well, this is a natural kind of segue into my next question I had for you is, I'm really curious, how did your work in DEI begin? And what do you wish today's pros understood about this work?
Yeah, so I started doing diversity and inclusion work a couple of years ago when I was working at this large academic medical center. At that time, I worked closely with many across this health system and within various different departments to ultimately work towards building a more inclusive work environment. This also included kind of building programs and events to educate and teach, employees how to be supportive to people of different races and ethnicities, disabilities, gender identities, and sexual orientations. The two things I want professionals to know and understand more about diversity, equity, and inclusive work is that first, it's a journey. It's not a one-stop, destination. And second, how important allyship is in this overall work. The process of fostering and nurturing an authentic culture of diversity, equity, and inclusion in the workplace is a journey that requires consistency. And I'll place special emphasis on consistency to be, successful. It's also critical to frame the conversation about diversity and inclusion as the challenging, multi-layered opportunity that it is. What makes diversity and inclusion, so challenging is that we have to think harder and discuss what is or is not acceptable in the various worlds we kind of construct and cultivate. And again, allyship is a critical key in terms of creating these inclusive workspaces. There's a Deloitte research or study that suggested that allies might be missing the link or might be missing link in kind of creating inclusive organizations and companies. And so employees in these organizations with cultures of inclusion and allyship, the reports show that they're feeling greater happiness and are more likely to go above and beyond for their employers. And the classic example I kind of give around allyship is around employee resource groups. I identify with two of our, I believe, 10 employee resource groups here at FleishmanHillard, which is our Black community employee resource group and our disability employee resource groups. And although there are others that I don't identify with, I joined them from an allyship perspective to kind of better understand those who identify as a Hispanic, Latino, or of the Muslim faith, or of the LGBTQ community, so I can better understand the culture, how they think, and how to best work with them, but together to build closer relationships with those particular groups.
Leadership is everything. And I really appreciate that internal focus. Because if you don't have that change within first, it's not authentically done externally. And that's when people, I think, get called out a lot. That's when organizations get called out a lot. You can't celebrate Women's History Month when you don't actually promote women within your organization or support and respect them. And that will come out. And so I love that you're doing that real work within. The action first, and then that communication of that after is really, really important.
Yeah, I think you have to kind of look to validate your point even more. You have to look internally at yourself and your organization before you can kind of provide that guidance and expertise to any type of external source, regardless of if that's a person within your community or to a client externally. But just using kind of like a car analogy, you got to pop that hood to see what the problem is internally before you even kind of take a look at the outside of the car itself.
Oh my gosh. I love that you use the car because I use that one a lot. And I said, well, what's under the hood first?
Yeah.
Let's fix that. And then we'll go drive you down the road. Okay.
Yeah.
And to that point of the journey and the allyship, I think those are two great points too. I mean, that journey is exactly it. Like using our car metaphor here, we're only going to go so far in our time, right, in this world. But the hope is that you're moving it down the road and then the next person gets in and moves that point forward. And that is truly being that ally. And what I tell people when they really get caught up in it is like, what would you do to be a good friend?
Yeah.
You know, sometimes it's just as simple as looking around the room and saying, who's missing, right? Whether that's some kind of external signal that there's a person of color missing, there's a person of a different gender missing, different lifestyle missing, different department missing, like whose voice is not being heard here? And how can we pass that mic and involve them in what we're doing?
As they would say in church, amen and amen.
Amen. We're going to be preaching. I love that. Well, that's great. And I like looking within. So how can we as professionals and our listeners here be champions of health equity and DEI in our communities?
So I think a champion to me is someone who believes in, supports and fights for a particular, cause. A diversity champion or a D&I champion, I think is a leader within your company or even your community that supports, diversity and inclusion, in the workplace, and who will find ways to make it happen in a way that benefits everyone involved. I think there are a couple ways to be a champion of health equity and diversity and inclusion, both in our communities and in the workplace. First, kind of creating that awareness and openly, talking about diversity and inclusion, addressing these issues, head on, and talking, openly about them kind of paves the way for reducing the barriers and starting honest conversations. Second, I would say by challenging, how you, define diversity, whether it's from a, corporate workplace perspective or even in the community. When people think about diversity, they usually think about race, gender, and sexual orientation to begin with. But when you define diversity as broad as possible, it should also include aspects such as education, disability, and culture and religion, to name a couple of examples. And then third, I think there's a large education piece. So educate, educate, educate. And I think it's the key to improving diversity, equity, and inclusion work. And understanding that, again, DEI won't be achieved overnight, and that it is a journey and it's a marathon and not a sprint. I think that is equally important. So the more messaging and the more guidance we provide in our communities and in our workplaces, we'll all be better for it. And then last, I would say, apply that lens of inclusion. The process involves, some introspection and empathy, and that's extremely important to kind of creating champions of DEI. And if I were to kind of name one other thing as a kind of added bonus, I would say promote and celebrate diversity, equity, and inclusion in our communities and workplaces. DEI efforts should be made fun. So an example would be getting involved in your workplace in employee resource groups or ERGs, or becoming involved with community events that promote diverse groups. I know most major cities have, for example, a Pride Month, parade or celebration. So maybe that's an avenue to kind of get involved in terms of celebrating diversity from a community perspective.
I think those are great points. And I think it comes back to, and like you were talking about, like awareness and talking about these topics and educating yourself and others. But I also want to add that we need to add a layer of warmth and grace to it all. Because I wouldn't say that anyone's professional opinion is absolutely 100% right. Right.
Yeah.
Because these are all about how we identify as individuals, how we like to talk about these things, what terms we like to use. And we evolve. And so this conversation and the communication, words and terms we use evolve too. And I will say, having worked in diversity and inclusion, there are some practitioners and there are some people in that space that can be a little more polarizing, that can be a little more harsh about their education.
Yeah.
Have you run into that, Thomas? But that doesn't help with allyship, right? That doesn't help with understanding and feeling like it's psychologically safe to ask hard questions about things we're ignorant about. We just have no idea. And we were taught something that we know now we're finding out is incorrect. So I just want to add that to the conversation, is that I love approaching all of these points that you make with an openness and a curiosity and having that dialogue versus really being that judgmental, this is how it is and how dare you not know that.
Yeah. And I love that you use the word grace, because in doing this work and participating and engaging in it, I think that you definitely have to have grace, but also have to have empathy and also respect, either way. And I think it goes a long way with kind of doing the work and engaging with others around the work too.
Yeah, absolutely. And I just want to honor you because I think that you've been so tremendous in our field. Representation matters to all types of people. When they know someone doing work that they like or they're curious about, it can inspire them to follow along. And that's this idea of trailblazing, is someone who's done something that was new, innovative, and a lot of times risky or scary. For us in public relations, we're still working to diversify our workforce and welcome and invite others in. And a large part of the book that I'll be releasing this fall is really that legacy gift, and that here's the invitation in and here's how you do it, because it's really important. And I love your position in being active on multiple boards and with the Public Relations Society of America, or PRSA, at the national level. That really gives pros like me something to aspire to. So what has inspired you to go above and beyond your day job in PR? Because we all know that's hard enough, right?
Yeah.
And how did reaching that high, how has it really shaped your career journey?
Yeah. So one of the things that you touched on in terms of representation, it does matter. I've said this a couple of times on different platforms, how it's, hard to become something that you rarely see or that you have never seen. So representation does matter. I've been a member of PRSA since 2017, and since day one, I've been an active and engaged, member. At the PRSA Dallas kind of local chapter level, I've served on every committee that you can possibly imagine, and was also elected as president-elect of our chapter back in 2020. And likewise, at the national level of PRSA over the years, I've served on a lot of different committees, from membership committee, the diversity and inclusion committee. I helped lead and launch both of PRSA's affinity groups, and co-lead our PRSA Black Voices affinity group. I often get asked how I've been able to excel in my full-time jobs over the years while maintaining everything I do for PRSA from a volunteership perspective. And my answer is always the same and very simple. I'm passionate about PRSA and the profession, and I want to see it in a better place than where it is today. I'm equally passionate about the work that I'm doing at FleishmanHillard. And for me, this is what I firmly believe, the work that I was intended to do. And I use the word work, but it doesn't even seem like a job or work to me. It just seems that it's something I was intended to do. And it's fun. And I love the work that I do. I remember not too long ago, just touching back on the representation aspects of things, this one person became CEO of a major global agency. And it's rare that you see that from the lens of a person who is a person of color. And so I sent that person a message via LinkedIn just to say, hey, I don't know you, but it's great to see your face, because it further validates that that could be me someday. And I know it can be done.
Which is awesome, because how I got Thomas on the podcast was like, I sent him a LinkedIn message and said, hey, I know you don't know me, but I've seen you online and I think you're awesome. And I would like to talk about what you're doing, because it's absolutely like full circle. It's, oh, well, I've been super active in PRSA San Antonio, and I've done, like you said, just been about on every committee since about 2015 for me, and was past president. It's like, where do you go from here? I looked at the regional board and I thought, well, I'm not sure. My business and work is here locally, right?
Yeah.
And it was during the pandemic when, I'll be honest, things got so tough for everyone. We're like, well, if not now, who knows when? And I got bold and I pitched PRSA and said, I'd like to write for your magazine. Yeah. I'd like to add a voice and some representation for the Hispanic Latino community. I know you're committed to D. I just don't see us in that conversation. And they took a chance on me, like my writing, and here I'm at, as a columnist. But even still, I just want to highlight this for people. Even still, I still have that self-talk that's not always positive. That's like, who are you to say this or ask that? And I just close my eyes now and I do it anyway. So that's why Thomas is here. And I sent that message. And what's so grounding for me is that everyone I meet, when I'm brave enough to reach out and they're kind enough to respond back, it just is very validating that a lot of us are walking that same path.
Yes.
Just different parts of the nation or different parts of the world. And if we talked with each other more and we're allies, we could really do something powerful. So that's awesome. And in the book, I talk about, because it's really centered on helping aspiring pros or journalists who are transitioning into PR, very much about trade associations and how I had no clue those existed when I was in college. Otherwise, who would I be now, right? I don't know, I'd probably be so much further along. But starting in PR, which was what was local and accessible to me in my market in San Antonio when I got started, it really gave me all the education that I didn't have an opportunity to have at my college. And I think that that's what's incredible about PRC or PRCA Americas, or there's so many trade associations that I'm still learning about in this space or in marketing and communication, that if you put the time in, like you said, you can take the profession and your career to a better place.
Yes.
I've loved this conversation, and I like to see what each of my guests say about this concept I have of smart talk. That is the name of this podcast series, and now it's going to be the name of my book. So what does smart talk mean to you, Thomas?
For me, smart talk is about that one thing, or maybe perhaps multiple things that you're passionate about and that comes natural to you, that you're perhaps an expert at, that you can share with and make an impact on people. So for me, I am very clearly passionate about diversity and inclusion and health equity. It comes natural to me. And again, the work I do at FleishmanHillard and for PRSA, it doesn't even feel like a job, because I'm so passionate about this critical work and what it means from what I do from a corporate perspective, how I engage people about it, whether that's friends and family members, and even people within my community. But that's what first comes to mind when I think about smart talk. One thing or few things that you're passionate about, that you know a lot about, but can also talk very clearly about, that makes an impact.
Love it. Intentionality, clarity, impact. That's smart talk. Well, Thomas, this was so enjoyable and super enlightening. What is the best way for our listeners to connect with you if they want to have more of your brilliance?
Yeah, and thank you for those kind words, Melissa. The best way for people to connect with me is for sure on LinkedIn. Right now, it's the only social media platform that I'm on. I'm probably the only Thomas Bennett who is all of 5, black male, wearing glasses. and is bald on LinkedIn in Dallas. So you can easily connect with me on LinkedIn. I'm very engaged.
That's so funny. I'm 5 and we all look tall on LinkedIn. So no worries. Well, thank you, Thomas, for sharing your knowledge and time with us today.
Thank you, Melissa.
And thank you to our listeners for joining us for today's episode. We love unpacking communication topics to elevate our industry practice. Keep an eye out for the release of Smart Talk, the book, this fall by following the podcast and our MVW Communication social media channels. And if you enter your email at MVW, you'll get updates on the release of my book. You'll be the first to know every milestone we make. And as always, think smart and communicate smart. And I'll see you next time.
Thank you for joining us for another episode of the Smart Talk series. If you learned something or enjoyed our conversation, share it on social media or send to a friend. To learn more about this and other communication topics, visit MVW360.com. That's MVW360.com.